Hi, I'm Dr. Adrian Fenderso from the All About Smiles Dental Office in Napa, California. I'm going to share with you just briefly an understanding of some of the terms in dentistry that might help you when you go to your dentist. You've learned them probably as a kid, but I'm going to review the teeth. You all know about your front teeth, the centrals, because they're right in the center. Those are called centrals on the bottom and top. They all get the same on the bottom and top, the same name. Then you have the laterals to the side, laterals. Then you have the eye teeth, we know as cuspids. Then you have the premolars or the bicuspids. There's two on each side on the bottom also. Then you've got the molars. The molars, you have three on the top on this side, three on the top, three on the bottom if you have all your wisdom teeth. So those are the names of the teeth. But more important, I want you to understand, because you're going to the dentist, he's going to talk about MODs and facials and buccals and linguals. What he's describing is the surface of the tooth where you might find decay or a filling. If you understand the surfaces, then you'll understand what he's saying. It's quite easy to remember. The front ones, they face out, and they're called facial, toward the face. So if you heard the facial side, you'll know he's talking about the front ones. Often the back ones, even besides they're facing out, they're called the buccal, because this muscle right here is the buccinator muscle. So those are the buccal surfaces of the teeth. So everything facing out is either facial or buccal. Now, on the tongue side, the lingual side, that's what it's called, the lingual. So if you hear you have a cavity on the lingual, you know it's the side on the inside toward your tongue. Now, there's the side that you either bite on, called the incisal, because you incise things, or occlusal, because you occlude on things. So that's the top surface. Now, the two other surfaces you need to know about, since the tooth has 5 surfaces, the top, the two sides, are the sides that face, or in between the teeth. One faces toward the center. The side that faces toward the center of your mouth, or the middle part of your mouth, or the mesial, is called the mesial side. And the one toward the distance is called the distal. So those are the 5 sides of a teeth, and you hear your dentist talking about a decay on an MOD, mesial occlusal distal, or a B, or a FB, or a DO. It's caused the distal occlusal, the shape of the filling or the shape of the decay on where it is on your tooth. Maybe a couple other things to understand is some abbreviations. You'll hear people talking about TMJ. That's the temple muscle, the temporal also bone. T, temporal. M, mandibular. J, joint. TMJ. You'll hear that often when dentists talk. And they'll talk about amalgams, which is a silver-mercury mix, and they'll talk about glass-filled resins, or porcelains, or glass ionomers. Those are the names of the materials that we actually put in teeth. Well, I hope that gives you a better understanding, so when you're into your dentist, you can actually talk to him about where your problem is and what tooth is giving you what problem.